I'm Dr. Dan Cox, a professor of counseling psychology at the University of British Columbia, and welcome to Psychotherapy and Applied Psychology, where we explore practical insights with leading experts. Today, I'm thrilled to welcome Dr. Dennis Kivlighan, a world authority on group psychotherapy. In our conversation, we discuss the group as a social microcosm, group facilitating new ways of being, the power of peer interactions in group, how to effectively train group therapists, and much more. Please leave a comment below. And if you enjoy this conversation, it'd be greatly appreciated if you hit the like button and subscribe to the channel. This episode starts with my guest responding to my question about if he couldn't be a psychologist or researcher, what would his dream occupation be? Let's jump in.
If I had the talent, I'd be a drummer.
Really?
Oh yeah, I played drums in high school. I love music. Uh, I I have a terrible voice. I love singing. There, there's no way to pursue that my real love in life. But if I could, I would be like a jazz drummer, uh,
Really?
jazz singer. Yeah.
Oh, that's the best answer I've gotten so far. Well, I don't want to say best, but it's certainly, interesting.
Yeah. No, I love
Okay.
music.
Oh,
It's just I always have music going. If we weren't talking, I'd be listening to jazz
gotcha.
at the moment.
Gotcha. So who are your favorites?
Um, well, I like a lot of the classic, you know, uh, Frank Sinatra. I like Michael Bublé. I like. Why am I blanking on her name? Uh, it'll come to me. Ella Fitzgerald. Just
Oh yeah.
I like mainly jazz singers. Uh,
Ah, okay.
so
Great. Okay. So then let's sort of pivot into
Diana
what you
Krall.
actually do.
Diana
Diana,
Krall.
Got it. Got it. Got it. Um, so then how did you get into studying group?
Um, so there were three sort of things that came together during my time in graduate school. One was we had a required group therapy class, and my advisor, Tom McGovern, taught that class. Tom was an amazing. You probably haven't heard of Tom. He
Uh-uh.
didn't do a lot of research, but he's probably the best teacher I've ever had in my life. And he's also an amazing therapist. And so he taught a group therapy class in our program, and it was back in the days when it was very experiential. So we basically did a Yellam. He basically led a Yellam type group for us, and it was incredibly powerful. I learned a lot about myself. I learned a lot about doing group therapy. Uh, I learned about relationships. It just was one of the best experiences I'd had to that point in my life. So that sort of cooked me on the emotional aspect of group and just how powerful it could be in terms of making changes. Um, at the same time, I was at Virginia Commonwealth University, and at the same time that I was taking that class with Tom, the counseling center there got a new director, Jack Corazzini. Jack is a pretty well known, or was a pretty well known group psychotherapy researcher, and I took a directed readings class with Jack, and we were looking at group development, and it, my dissertation came out of that work that I've done with Jack, and so that was a nice marriage of the more practical stuff that I got with Tom, and then the more theoretical group therapy stuff that I got with Jack. And then Don Kiesler was in the clinical program at VCU, and he taught an approach on basically doing interpersonal therapy. And and interpersonal therapy is, of course, the, the theoretical foundation of group therapy and all the work. And just Kiesler was uh, like Tom. He was an incredible teacher, but also the theory, the interpersonal theory, just made so much sense to me, and it of course fit so well with the group area. So those those three things ended up sort of coming together, melding together for me. Uh,
Can you put it when you said that it was a Yalom type group? Could you put a little bit of meat on the bone of what that means?
so it was, yes, it was here and now oriented. So we did a lot of work with the relationships among us in the group, uh, a lot of focusing on understanding our strengths and weaknesses in terms of how we came across, real emphasis on feedback, interpersonal feedback, in terms of uh, what we did that either would push people away from us or pull people towards us. Uh, and, and also less of an emphasis, but some emphasis under trying to understand where those patterns came from, how we got to where we developed our interpersonal style. But I think the main
And
thing was the here and now focus, and within the therapy group.
when you said earlier that you had like it was very personally meaningful for you. Could you like could you give more specifics in terms of what that was like or what that was?
Um, I mean, I really learned a lot about me. I got, um, I'd gotten. I was not a good student in high school, and uh, my my mother was always pleading with me to, couldn't you just try a little bit? And no, I can't. I don't want to. Of course, I didn't say that. I just was a bratty, adolescent and ignoring her. But that sort of that message that I got from that was, you're not doing enough. You need to, and I and when I got out of my bratty adolescence, I, sort of when I did sort of finally in graduate school decide that I needed to apply myself, it was like, I never felt like I was enough. That it was, um, I wasn't good enough. I wasn't enough in any way. And I think that was one of the things that I learned in that group, that sort of how that affected my relationships, how that, how I would, um, not trust that I was doing enough um, in my relationships with people, uh, how it felt I'd never, how it would keep me from feeling sort of satisfied in those relationships, and then helping me connect where that had come from in my earlier life. I think that's one example of something I learned in the group.
So because of what the process was happening in group, that was able to sort of emerge and you were able to like recognize
Yeah,
that.
because you would see that in my relationships with my peers, that that I would not, I'd always be trying to sort of do more, and uh, not being able to just sort of accept that I was okay um, in the moment. Uh,
So this leads into something else I wanted to ask about. So I remember being in graduate school. My memory is that Jim Lichtenberg, who you probably know Jim,
yeah.
I would guess. I remember him talking about psychotherapy as sort of a social microcosm of your life,
Mhm.
right? That these dynamics and things play out. And I remember sitting in graduate school and sort of thinking, like, is it? Like this is a question that I have. Is it? Because it is contrived, right? It's not a real place. And so then, but we sort of oftentimes psychotherapists sort of assume that it is. And you've done some work on this in the group context. And when I read it preparing for this, I was like, oh wow, somebody who actually did some empirical work on this and has thought about it more so than just assuming it. So I guess so. My question is: so is group a social microcosm of your life?
Yeah, yes, and it's more complicated than that. So it's, um, one of the things that I love that Kiesler said was that the person you're working with doesn't have to tell you their problems; they'll show you their problems. That and that's sort of the colloquial way of thinking about the social microcosm. It's going to be there whether you want it to be or not. It in some ways it can't help but happen. But like in individual therapy, the client isn't in the room by themselves. They're in the room with you as a therapist, and uh, so when you look at our interaction, it's partially what they are bringing, the client is bringing to the interaction, and how they've behaved in their past relationships. But their behavior is being influenced by me and what I'm bringing to the relationship, and how that influences how I'm with the client. So you get sort of a meld of both of our social microcosms uh, in the in individual therapy, and then just think how much more complicated that gets in the group. So it's yes, I bring in my that belief that I needed to do more, that I wasn't good enough. I brought that into the group, but then other people brought their own uh, social microcosm in the group, and the group becomes a melding of those different social microcosms. So yeah, our our research does show that if someone um, we look at intimate behavior as a vehicle for trying to understand the social microcosm. So if someone has problems being intimate in their outside relationships, you'll see that in the group. Um, but you'll also see that if, for instance, if the other group members don't have problems being intimate in their outside relationships, that'll sort of pull that member who does have problems, uh, it'll pull them along. It will help them to not have as many problems with intimacy as they might if they were in a group full of people who also had problems with being intimate in the outside relationships.
So, so when you say intimate behavior, what do you mean?
So things this the we use an instrument that was developed by William Schottish. Uh, it was for his dissertation. He actually started out as a group therapy researcher, and he just developed a checklist of different types of what he called intimate behaviors. So it would be like uh, being vulnerable, revealing something vulnerable about yourself. It would be giving feedback to other people. The types of behaviors that would um, deepen a relationship, make it more intimate or caring. So we just look at that behavioral checklist as a way of trying to understand how intimate or not intimate a person is in the group.
As I was preparing for this, I was thinking about how I was thinking back to my group class in grad school, and I sort of had this experience to an extent of I don't know. group being not. Now, let me say this a different way. Like, I sort of feel like in reading and thinking about your work that you study group, but in an interesting way. that that even just listening to you talk in the last 10 minutes, that those processes, those things that are occurring, how you're talking, just talking about intimate behaviors and um, uh, clients being willing or not willing to, and how other clients pull for those things, that it's so sophisticated. And as a, someone who's trained as a psychologist and really, what I got, it's like, it's exciting. It's like, oh, this is really cool what you're talking about. And so I guess where I'm trying to go with this is, to an extent, I guess I want you to explain a big picture, of course, like how you've come to think about how groups are helpful, like how group psychotherapy is helpful for folks.
I'll try to answer that, but I want
Yeah.
but I want to before I do that, I want to comment on what you said about, that's what I love about doing. The thing I love about doing group psychotherapy research is that it's so complex. It's, there's so many moving pieces, and that it's fun from a sort of an intellectual point of view, trying to capture all that. But it's also fun from a statistical point of view, trying to come up with models that can capture that complexity. For years and years, when we were studying group therapy, we were basically just studying individuals who happened to be in a group. And it's only within the past 10 to 15 years that that we have these models where we can actually study how people influence each other, and what the the being what the group sort of brings to the process, that you're different when you're in a group than you are in other settings, and we're starting to be able to capture those things. So that's I think one of the exciting things about really getting to do group therapy research is that it really you do get to try to understand some of that complexity, and we're with the plate we're at the place now that we have statistical models that can help us to do that. And in fact, actually, I think I tell some of my students that actually we can do the group theories have to catch up with where we are.
Right.
The group theories are too simple. They don't, take something like Yalom's curative factors. Everybody knows about Yalom's therapeutic factors. How old I am. Back in the day, he first called them curative factors, and then he got more modest and changed it to therapeutic factors. So when I started reading him, he thought he could cure people, and then he realized that he was lucky if he could help them a little bit. But it was we didn't think about them so at the level of even a simple question like is this an individual factor or is this a group factor? What's the like cohesion? Is cohesion my sense of whether or not I'm attracted to the group, or is cohesion the group's sense of whether or not people are attracted to the group, or is cohesion the coming together? I mean, this is my preferred view: is that cohesion is something different than just feeling good about the group. It's that we are on the same page. We all see things in a similar manner. So we can now start to ask questions about that. But, Yalom doesn't really make makes distinctions about what is cohesion. Is it an individual thing or group thing? Is it a sort of a meta process of that coming together? So that was my sidetracking. So I actually remember your question. I'll get back to it. Um,
Go ahead.
so with those, we're, we're getting better able to try to answer your question of what makes group helpful. Um, what does make group helpful? I think part of what makes group helpful is that it it gives you a it is a place where you can try new ways of being in the world, and you can get feedback from other from real people about the consequences of those experiments that you're doing. It's if I want to be um, if I want to use therapeutic language, it's I think the core of what makes group helpful is the corrective experiences that happen within that space, and the yeah that you've learned, that you've had the opportunity to try new ways of being in the world.
So you said two things, which is new ways of being and corrective experiences, that I think would be worth
Mhm.
digging a little deeper on.
Yeah, I think actually I'm equating those two. I think a corrective experience is a new way of being in the world. So we get into our patterns of experiences that uh, we we've learned, for instance, that that we may someone may have learned from their background that it's hard to that they shouldn't trust other people. I had a group therapy member one time who was talking about trust, and usually, we learn these lessons not implicitly but explicitly. We learn, for instance, if someone learns not to trust, they learn that through observing, important people in their life. They learn that through some experiences that they had. But this one group member uh, still makes me sad to think about it. She talked about how her dad would. Uh, she would be standing on some steps, and her dad would say, "Jump to me," and she would jump to him, and he wouldn't catch her. And he would say, "You have to learn. You can't trust anybody." Can you imagine?
Yeah.
Um,
I mean, when you said explicit, like that's as explicit as it gets.
yeah, I've never heard that. I've never heard that uh, message of you can't trust anyone taught so explicitly as in her story. But you so you get you have these uh, views of the world or these ways of being in the world. So I'm not going to trust anybody. And then uh, the new experience is taking the risk of trusting someone. And um, what makes it corrective is that it counters that. So if you take the risk of trusting someone, and that trust is I'm losing my words, if that trust is fulfilled, then that that becomes the corrective experience, is because it's a experience counter to the messages that are getting you in trouble. So the new experience is a step towards what's possibly a corrective experience, depending on what happens after the risk that the clients take.
When I think about group, I think about that and how you're talking about that one of the powers is that relative to individual is that the corrective experience happens with a peer, right? That if I'm the therapist, that corrective experience or a similar corrective experience can also occur.
Mm-hmm.
And there is something to be said for that corrective experience occurring with a peer, right? This person's not a professional, or these other people in the group are not professionals. They're not being paid. In fact, they're paying typically, and that corrective experience could be or has the opportunity to be particularly powerful because these are just, these are civilians. These aren't therapists. These are just regular people.
Mm-hmm.
And it also really speaks to the unique role of the therapist or therapists, but the therapist in group.
Mm-hmm. Yes, it does. And, as therapists, we're always tainted. It's always, oh, you're just saying that because you're just doing that because you're the therapist. And, you fight against that. One of the phrases I use is that, I'm not an emotional whore. You may be paying me, but you can't buy my emotions.
Right.
If I care about you, that's a genuine care about you. It's not a bought care.
Right. It's not contrived. You're being real.
Yeah, but no matter how much you fight against it, you are still a little bit tainted. But the other group members aren't. They aren't being paid to care about you. That's not their job to care. They're not in there to care about you. And if they end up caring about you, it's because they genuinely care about you. And so, yeah, that's powerful. And that, in Yalom's early research, what he finds is that if you ask people what were the most important interactions that they had in the group, they were interactions with other group members, not with the therapist. That the group members, and I think this is where you were going, the group members actually do the therapy in the group. So then what's the therapist's job? The therapist's job is to set that in motion, to help them to be the therapists who are going to be effective for each other.
So I think I didn't really get what effective group process could look like until I was on internship.
Mm.
And I was a part of many groups before that. But it wasn't until I happened to have be in a group with somebody who like really got what you're talking about, then I was able to see it. And I was like, oh, this is what we're supposed to do. Oh, this is and it's just, anyway. So my question is about training, how to do, and you talked about earlier your personal experiences. But how have you come to think about, if you're czar of the training program at Maryland or wherever you happen to be, what would effective group therapy training look like?
So actually, I'm going to go back to my time at Missouri. So when I was at Missouri, I had never intended to be a faculty member. That just sort of happened to me. I didn't think I was capable of doing something like that. So actually, I worked in counseling center to begin with. I was a staff psychologist at the University of Maryland Counseling Center, and was fortunate to work with Charlie Gelso and Clara Hill, and they were the ones that encouraged me to think about going into academics. And so when I left the counseling center and went to Missouri, I was actually in these old-fashioned joint positions. I was a third of the time in the counseling center at Missouri, and 2/3 of the time in the academic department. So I was always doing that, um, balancing that practice theory type of thing, the science practice type of balance, and it was an impossible situation because but it was a wonderful situation. I mean, because you had to do them both. You had to, and you had to figure out ways to put them together. And so that's it. I feel like we developed a really good group training model at Missouri, uh, based off of some of the things that Yalom does, but also based off of some of the work in family therapy. You know, in family and couples therapy, they do a lot more observation typically than we do in uh, either individual therapy or group therapy. And they do a lot more active in the moment supervision. You know, it could be like the bug in the ear, it could be coming into the group. So what we did was we would have for our interns in the counseling center, we would have 3 or 4 interns a year, and we would have one training group where it was an ongoing open-ended therapy group that had been going on for years, and so clients would come in and out of that group, and there were 2 of us, therapists, PhD level psychologists, who sort of were the leaders of the group, but the interns also co-led the group with us. And what we meant by that was that there would be 2 co-leaders in the group at any point in time, but it could be, but it would typically be one of us, PhD therapists, and one of the interns, or could be 2 of the interns, and the other of us would be behind, and the rest of us would be behind the mirror watching what was going on in the room. And there was a lot of, I think that there was a lot of really good learning behind the mirror, because you could talk with experienced therapists about, oh, what do you see? What are they doing well? What are they missing? What would you do if you were in there? And the piece that we added to that, it wasn't just what would you do if you were in there? It's, oh, that's a great idea. Go in there and do that.
Oh, wow.
So we would, how I would describe the training program to the people who did it was like a permeable membrane between the observation room and the group room.
So you would literally walk out of, like, regularly. I mean, just you'd be in the back behind the 1-way, 2-way mirror, whatever it is, and then you'd walk in, sit down, and you would.
Yep.
Just
you would say, well, I was noticing this. I wonder if you would want. I wonder if we could, try this, or I think this is going on. How does that sound to you all? Yeah, we would.
And so this group was just running sort of regularly, week after week, for years. And so it sort of became this, it was normalized. Like the clients knew what they were getting into. Probably some of them had been there for several years, or for a couple of years. Some of them were new, but then that's fascinating.
What was so interesting, Dan, was that we would, I started this model and loved it, and thought, oh, wow, this is an incredible training experience. And at one point, the group member said, you all get to observe us. Why can't we watch you all debrief? Because they knew we debriefed afterwards. So we
Sure.
so we said, sure, you can debrief.
Yeah.
And then after a while, they would say, well, when you all see something that you think's not getting addressed in the group, you all come into the room. Can we come into the room if we, if we disagree with something you're saying in the debriefing? And so they started. The group members started coming into the room.
So you did that regularly, where you had the group members watching you
Yeah,
all process
they
after?
would watch, and they would come in, and they would say, "No, we don't agree. This, we
Whoa,
don't think you've got this right." Uh,
that's amazing.
isn't that amazing? Yeah.
But I mean, that's sort of what I mean, it's tough, right? Because there's probably certain things you might not quite just, you're going to be a little gentler, right, in how you talked about it with your peers, because you know that you're being watched by the group members. But that's kind of what you want, right? Which is we're conceptualizing what's happening. But then actually to get immediate or close to immediate feedback from the group that says, no, I wasn't struggling with that. No, I was over here worried about this thing, or I was worried about her. I wasn't worried about me, right? So you get to reformulate your conceptualization based on their feedback.
Mm-hmm.
That's fantastic.
Yeah. Isn't that amazing? Yeah. And they helped us develop the model. I mean, we didn't go in with this model fully laid out. It was
right.
They and I've always tried to reduce the power dynamic in therapy, and it's I think the closest that I've come to try to eliminating that power dynamic as much as possible when you have that open sort of thing.
Oh, go ahead.
No.
So as you were talking, I was thinking about, I had one of in the first, I don't know, maybe the fifth or sixth or fourth of these I did was with Scott Miller. And so Scott was talking about how when he was first doing training, or when he was getting into, I don't remember where exactly in his, but that, he was doing a lot of solution focused stuff at the outset. And he was in Wisconsin, I believe. And he was talking about how they would do so much live observation, and it was research and practice, and they're bringing in people from the community. And I said to him, I feel like that let me bring it into the present, but there's echoes of it that I'm like feeling, which is like that, what you're describing. It just, to me, that feels right to me. Mm-hmm. It takes time and energy, but it's like, that's kind of like why we got into the business to begin with, the types of things that you're describing there. And it feels like to me that those types of experiences are less common than they used to be. Mm-hmm. Do you agree with that?
Yes, I do agree with that. But I would say I'm not sure how common they ever were. I mean, I think they were in some particular programs they were common, and in some particular approaches, like more family couples therapy, for whatever reason, that seemed to evolve in a much more open way in terms of happening. But it's I almost feel like it's cheating almost. I mean, so since the time I've been in Missouri, I haven't ever done an individual session or a group session that hasn't been observed. But they are making me a better therapist because I always want them to, if I'm missing something, to come in to the group or come into the individual session and help me be a better therapist. I think they get a lot out of learning that, and they get a lot out of coming into the room and trying the things that they're talking about. I mean, it's easy to talk about,
Yes.
It's easy to, come up with a million ideas of, what you could do or it's easy to criticize, oh, I would never do that, or if I did this, everything would be different in there. But it's actually putting that, uh, you know, the rubber meeting the road, trying to put that into place is just. I think it's such a great learning experience, and it's immediate. It's not, it's it's not like most supervision that, well, this is what was happening then. You could have done this. But it's that's not what's happening the next week, and it's you've got to I think you have to bring the learning closer to when it's happening, and that the way you do that is through the observation types of things. And I think it's good for learning group, but it's also good for learning individual therapy.
But it reminds me of like the first one of these I did was with Terry Tracy, and he talked so much about like testing your hypotheses.
Mm-hmm.
Like clinicians should test their hypotheses, right? And like that's how you do it. I mean, that's a way to do it, right? Which instead of our more typical way of doing supervision, which is the next week or whatever, you're talking about the client you had last week or the group you were in or whatever, right? But you don't know, right? So the supervisor can sound very smart and say, oh, this is what was going on. You should have done this. But you don't know. Where in that case, what you're saying is, right, as trainees, I'm sitting back there. I get to develop a hypothesis, and I get to go test it and see what happens. And then you're layering on top of that, which it sounds like the clients, brought to the room, which is, hey, now we're going to watch you. So we're going to give you, so it's not just in the moment, but then also when you're processing what's happening, then the group is giving you more feedback, which again is testing your hypotheses. Even if you didn't want them tested, the group's going to make it be tested.
Yep, exactly.
So you talked about earlier the your experience in that like that training process group, where as trainees you all were in sort of doing a process group as trainees. What do you think about that model?
I know that there are a lot of issues about dual relationships and relationships with peers, but I don't think you can learn that stuff just by reading a book or just by doing role plays. I think that it's really, I mean, having the experience of self-disclosing and if you, appreciating what it's like for learning to appreciate what it's like for clients to self-disclose in a setting with other people, trying things out in real time. I mean, I think the movement away from more experiential approaches to training has been a loss for the training of therapists. That I think without that experiential piece, training is less meaningful, less impactful. So I think you have to build in safeguards. I think you have to really help people to understand, and you have to make sure sure, like you said, well, I'm going to make this safe for you, because if you say something you're not sure you want out in the world, just let me know and I'll edit it out. That was a safeguard for me. And so you build in those safeguards. But I really think that the experiential training is an important component of should be an important component in every training program.
Thanks so much for watching. And if you enjoyed this conversation, don't forget to like and to subscribe. And be sure to check out the second part of this conversation in the next episode. Until next time,